Hi guys, I hope you're hanging in there, doing well. On the open lab on Friday, we went over some nursing diagnoses and realized that a lot of you guys have this book and are not totally sure how to use it, which we were in the same boat. It's a pretty confusing book when you first get it, but once you get the hang of it, it's going to streamline your care plans, make them way faster, way easier in coming up with those nursing diagnoses. So I will do a little short and sweet presentation for you guys, highlighting how to use the book and all of that. So yeah, let me share my screen. So here's what that book looks like. I have a PDF version of the 11th edition, but then I have the 12th edition right here in front of me. So the first thing you're going to do when you have your patient, you have their diagnosis, their medical diagnosis, that is. When you're working on your care plans, you're going to want to come up with nursing diagnoses. And this book, any of them in this book are totally fair game. Coming up with your own, a lot of clinical faculty won't accept that, and you're going to want to use the NANDA ones, which that's what's in this book. So if you flip to, on the physical book, there's this front section that's green. If you can see that, I'm going to go on in, hang with me. There's also a section in the front that will teach you how to use it as well, but if you're more of a visual learner, just follow along this video. So let's say our patient has pneumonia. So we're going to go to this green section in the front, and as you can see, it goes alphabetically, and it's going to have all of your common disorders or diseases. So we're going to scroll down and find pneumonia. N-O-P. So let's find pneumonia. Here we go. So as you can see, if you look under pneumonia, it's going to give you all of these nursing diagnoses. So you see activity intolerance related to imbalance between oxygen supply and demand, ineffective airway clearance, impaired gas exchange, effective health management. There's a ton of them. And in our care plans, we do 3 typically. I believe that's how your guys' are too. And then you see the risks for at the end there, which you can also include in yours. So once you get to that in the front green pages, you can make a list, take note of whichever ones you like, whichever one you think are most related to your specific patient. So let's say they have impaired gas exchange. So then the meat of the book has all of these nursing diagnoses. So I believe it's that bold letter, the letter of how you'll find it in the book. Instead of like impaired, you're going to look under gas exchange, so under G. And I flipped right to it. So it's this purple section, it'll say impaired gas exchange, and I'll have all of this on the side. Let me flip to it in my PDF book as well. So here we are. It's, we flip to impaired gas exchange. So it'll give you the definition, defining characteristics. Here you can decide, oh yes, this is my patient. If not, go back to the front and see what that would be. Your related to factors, which are also in your care plan. Nursing outcomes, it shares those with you. Right, if you see client outcomes, those ones are really good. And then you always want to add a value to those, something measurable. And then your interventions, and it'll give you a really long list of interventions. All of these would be really great to include in your care plans. And yeah, so you pick 5 of those, 3 outcomes, there, boom, there's your care plan. I'll show you guys one of my care plans. It's a little messy. It was a real one I used for a patient with pneumonia. So it looks like I used impaired gas exchange as problem number 2, related to functional lung tissue as evidenced by level of consciousness. Like I said, this is really messy, but I've got all of my outcome boxes filled in, and I've got all my interventions filled in, and our textbook just makes that super easy. Let me stop sharing. So I hope that was super helpful for you guys. It was a very quick video. If you have any questions, please reach out to me. If something didn't make sense or any questions at all, feel free to reach out to me. I hope that was an easy little crash course for you guys of how to use this book. Thanks for your time. Bye.